So let me bring you up to date as a senior citizen on what the risks are with COVID-19. You're at highest risk if you're over 70 years old, particularly if you have other medical problems. So it's going to be very important that you use really good common sense along with what we know about the disease so far to help reduce any potential bad outcomes. If we start getting more cases in our area, that's going to mean that you're going to need to socially isolate yourself. And you know what that looks like? That means maybe not going to church, maybe not going to clubs until this is allowed to run its course. You're going to have to shop. You're going to have to get gas. So how do you do that? You're going to have to pick times where there are least amount of people. You go into the store, you get what you need, you come out, you sanitize your hands before you touch your face. Remember, this is droplet transmission. It can stay on surfaces for 6 to 8 hours. So before you touch your face, that's inoculation, touching a surface, touching the gas pump, touching the doorknob, and then touching your mouth, throat, or eyes. Before you do that, sanitize your hands. It may mean if anyone's sick or has been around a sick person, they don't come to visit you until this runs its course. Again, I'm saying running its course because this will get better. We're just going to have to outlast it. And then the final thing is, when do you go to the hospital? If you start running a high fever, if you start having chest pain or you're short of breath, that's when you go to the hospital. But look, common things are common. You could just as easily have a community-acquired pneumonia or an influenza as the COVID-19. In terms of testing right now, we're not doing any testing on people that don't have symptoms. So don't worry about going to the hospital for that right now. If you get sick enough that you have to go to the hospital, go there and they'll test you. And then finally, I'll say this. If you can avoid some things, like if you have a well visit with your doctor and they can call in your prescriptions, just call their office and have them call it in as opposed to going to the doctor's office itself. That can save exposure as well. So there's some common things we can do, and we can reduce our chance of having bad outcomes in a lot of our citizens in our community.